Once you have established and justified a DSM diagnosis in the intake assessment, the second most important thing that you absolutely have to include in your intake assessment is medical necessity and functional impairment. In the eyes of insurance, your client might meet the criteria for a specific diagnosis, but if you don't show that it is negatively impacting their ability to function in their everyday life, then insurance won't pay for it. Let's talk about what functional impairment means, because this is another one of those words that when you understand what you're looking for, you can translate what the client is telling you in their intake session into insurance appropriate language without them having to know how to speak that language. There are a lot of areas in life that we as human beings need to function occupationally, personally, academically, in relationships, self-care, caregiving, or parenting, socially, cognitively, physically. In order to demonstrate the medical necessity of therapeutic treatment, we need to demonstrate that the client's diagnosis and their current symptoms are impairing their ability to function in one or multiple of these functioning domains. If you've done a good job establishing and justifying your diagnosis, it's usually pretty simple to make this next leap into how this is impairing function. So let's say you have a client who is experiencing the symptoms of generalized anxiety disorder, meaning that they are experiencing excess worry in their life. Other symptoms of GAD include sleep disturbances, irritability, fatigue, difficulty concentrating. And if your client is experiencing those symptoms, it's pretty easy to explore how those symptoms are impairing their function in various aspects of their life. So if they're experiencing difficulty concentrating, where is that showing up? At work? At school? If they're experiencing irritability, is that impacting their relationships and their performance? While I do include a statement of medical necessity in every single one of my notes, just so insurance can never say that I didn't address it, you are justifying the medical necessity of treatment throughout the entirety of your note whenever you discuss symptoms and how they're impacting the client's life.